In this presentation, we will have a brief overview of the spine and of spine disorders. Our brain and the spinal cord constitute our self. So the skull and the spine can be considered the guardians of ourself. The brain is encased in our rigid and incompressible skull. The spine encloses the spinal cord. The spine is incompressible, but it has been segmented and articulated to provide motility. The vertebral column offers the spinal cord protection while it confers mobility to the body. The spine is the axis around which the body is constructed. It provides structure and support. They encase the brain and the spinal cord. The spine is made up of the vertebral column, which has got 7 cervical vertebrae, 12 dorsal vertebrae, 5 lumbar vertebrae, the sacrum and the coccyx. Each vertebral body, or rather each vertebra, has a body. It has got 2 pedicles, one on each side, and the pedicles continue behind as the 2 laminae. At the junction where the pedicles meet the laminae, you have transverse processes. And posteriorly, where the 2 laminae meet, you have a spinous process. Intervertebral discs are composed of an outer firm annulus and an inner soft nucleus pulposus. There are ligaments which hold the bones in position. You have an anterior longitudinal ligament, a posterior longitudinal ligament, and posteriorly you have the interspinous ligament. You have a capsuloligamentus supports for the intervertebral joints, and you have another ligament called the ligamentum flavum, which extends between the laminae of the vertebrae. Bony stability and alignment are maintained by the ligaments and discs, which are static supports, and muscles, which provide dynamic support. Normal spine has got anterior-posterior curves. In the cervical and lumbar regions, we have a lordotic curve. And the thoracic region, we have a kyphotic or forward bent kyphotic curve. Deformities of the spine can be scoliosis, that is a lateral bend of the spine, or kyphotic, which is a forward bending of the spine. Scoliosis can be idiopathic, structural, or paralytic. And kyphosis can be post-traumatic when there is a wedging of vertebrae, or it can be degenerate. Vertebrae can be affected by infections, which can be acute or chronic. Injuries which affect the vertebrae can be produce fractures in the vertebrae. There can be dislocations between the vertebrae, and a chronic subluxation of between the vertebrae is called a listhesis. Malignancies can affect the vertebrae. Primary malignancies, the bones. Metastases, which are much more common. And the metastasis to the vertebrae might be infiltrative, or they might produce pathological fractures. Metabolic diseases affect the vertebrae, and osteoporosis is the most common. Intervertebral discs have an outer firm covering which is called the annulus fibrosus, and an inner soft gel which is called the nucleus pulposus. The discs act as shock absorbers, and they give height to the vertebral column. Pathologies which involve the disc include disc degeneration, which happens normally with age. With injury, you can also have a disc prolapse, where there is a rent in the annulus fibrosus and part of the pulposus protrudes out. Disc infections can produce discitis, which is an extremely painful condition in the acute stage. Sometimes you have chronic infections where the pain is not so much. Abnormalities of the ligaments involve an excessive laxity of the ligament, which might result in instability of the vertebrae, or a chronic, long-lasting instability might result in hypertrophy of ligaments, which can produce neurological compression. Deformities of the vertebral column might be temporary, as occurs in muscle spasm associated with some disc prolapses or with injuries. They may be structural because of an abnormality of shape of the vertebra or because of a pathological fracture, or it might be paratic because the nerves supplying paraspinal muscles have weakened. Pain might be just spinal pain. The commonest cause of spinal pain is probably vertebral microfractures, which are very common with osteoporosis. Intervertebral joints might develop arthritis. There may be muscle injuries or spasms. Ligament injuries and ligament stretch can also result in back pain. Radicular pain includes sciatica syndromes in the leg and brachialgia in the arms. Meralgia paresthetica is a classical lateral thigh pain, which is also radicular but of not very obvious cause. Claudication pains are pains which are not present all the time. Claudication is classically provoked by exercise. When you walk for a while, you get pain along the distribution of the nerve, usually the sciatic nerve. Claudication can also be produced by posture. A person might have no pain lying down, but when he or she stands, there is compression on the nerve and pain along a nerve course. This usually suggests an instability. Deficits might be present with spinal pathologies. You can have a sensory loss along a nerve distribution, which is usually the first phase. Following this, you can have motor weakness, that is, a muscle group gets weak. For example, plantar flexion, that is, when you stand on your toes, may not be possible when the S1 root is compressed. Or dorsiflexion, when you stand on your heels, you're able to raise your forefoot, is not possible when the L5 root is compressed. Cauda equina syndrome implies compression of the nerves as they pass through the spinal canal, including the nerves which control micturition and the bowel. So the person might be incontinent of stools and may have retention of urine. A large segment of back pain patients and indeed cervical pain patients can be relieved by providing them with a spine regime. In low back aches, we tell them to avoid three things. That is, avoid loading the spine, that is, carrying heavy weights, flexing the spine, that is, bending forwards, and impact to the spine. This happens when a person jumps and lands. There is a sudden compression of the disc. We encourage these patients to do three things. We encourage them to walk. Walking causes contraction of the paraspinal muscles. Hanging is good, hanging from the hands, because then there is a traction to the spine and some nerve compression gets relieved. Spine toning exercises are recommended because improving the tone of paraspinal muscles provides additional support to the vertebral column. Calcium supplements and vitamins are often given, and GABA inhibitors like gabapentin or pregabalin may be used to relieve nerve pain. Surgical treatment of low backache sciatica syndromes involve basically two types of surgery. One is decompression. A collapsed intervertebral disc may be removed, which is called a discectomy. Or you can have excision of hypertrophic ligamentum flavor, or a laminectomy may be done to relieve spinal canal stenosis. Stabilization aims at restoring the alignment of the spine and retaining in that position. Stabilization prevents recurrence of nerve conversion. Usually, either posterolateral pedicle screw constructs are used for spinal stabilization in the lumbar region, or interbody fusion can be done along with pedicle screws. In the cervical spine, anterior cervical discectomy infusion is the commonly done procedure. Sometimes in cervical myelopathy and the patient has kyphotic deformity, lateral mass fixations can be done along with a laminectomy.